Welcome. My name is Robert Tasker and I'm your editor of Pediatric Critical Care Medicine. August 2022, great issue. Please have a close look. I've got 3 editor's choice articles and I'll jump straight in. Verlinden et al. From the Pediatric study, which was the nutrition study in the New England Journal of Medicine, have been able to do a developmental trajectory post-PICU, looking at patients 2 and 4 years after the study. 600 patients, 350 matched controls, unique in the follow-up, so well worth a read. Alcamo et al. Have looked at the Sprout data set, and they've looked at 550 patients, 128 PICUs, 26 countries, over 5 days as a point prevalence, and they've been interested in studying neurological dysfunction at the time of sepsis, really trying to get a handle on this entity called sepsis encephalopathy. And the third article in my editor's choice is really 2 articles, one by Levy et al. And one by Pershman et al. So this pair of articles addresses the question of peripheral vasoactive agents for shock. We have 230 patients in the USA, 200 patients in the UK, and a great editorial by Kate Madden putting this all into context. For my connections papers for the regular readers of PCCM, there's an article about social determinants of health in acute respiratory failure, both looking at a micro level or individual level, as well as a macro level, neighborhoods, and social risk. The second article in my connections is another article in the LAPS studies, this time looking at pathogen and sepsis outcomes. And the third article is MIS-C and the hemodynamics associated with MIS-C. Last, there is no PCCM narrative this month. Instead, I think that there's a great editorial on emotional intelligence. Alice Ackerman, my attending during my fellowship days from 30 years ago, has written a great piece, and I would commend that to you. If you're not aware of this already, we're now beta testing an audio version of the abstracts of PCCM that you will be able to access as PCCM pediatric section members. Go to the website, have a look, sample it. As I said, it is beta testing. If you've got comments, if you think that there are ways that we can improve it, if you're even thought that you might volunteer and be one of our audio voices for the abstracts, I would love that. Just contact me. So thank you very much, and I'll see you in September.